What if I told you there's a disease that kills more patients than bowel and breast cancer combined, or that someone with this disease is 5 times more likely to die than someone suffering from a heart attack or stroke? This disease could strike anyone, at any time, and at any age. Sepsis. Sepsis is one of the leading causes of morbidity and mortality across the globe, accounting for more than 6 million deaths annually worldwide. It occurs when the body has an overwhelming response to an infection, and if left unrecognised and untreated, results in organ dysfunction and ultimately death. In 2011, the New South Wales government introduced a sepsis pathway across all emergency departments to improve the early recognition, resuscitation, and referral of patients with sepsis. One of the key aspects of this guideline is the administration of antibiotics within 60 minutes of recognition. However, we do not know how guidelines has changed practice amongst emergency clinicians. My research aims to determine the impact of sepsis guidelines on the assessment and management of septic patients, and to provide further insight into how healthcare practitioners use these guidelines in an emergency setting. For the first part of my study, I conducted a medical record audit of adult patients with a sepsis diagnosis before and after the implementation of guidelines. I discovered that patients presenting with sepsis, on average, were seen 19 minutes faster. There was also an improvement in time to antibiotic treatment, and this was demonstrated by a 230-minute reduction in the average time to antibiotics from 308 minutes to 78 minutes. The second part of my study is really looking at sustainability and the impact of guidelines on clinician behaviour. Specifically, what are clinicians doing? Have they been able to sustain change in practice? To answer this question, I'm going to conduct a second medical record audit 4 years after the implementation of guidelines. Focus groups and interviews with ED nursing, medical staff and key stakeholders will provide further insight into the implementation of guidelines and how they've managed to change practice and clinician behaviour. This research will contribute to our understanding of how evidence-based practice guidelines are implemented and determine if they're sustainable in a real-world clinical setting. It'll also determine how guidelines have managed to change practice and clinician behaviour. This information will ensure that patients presenting with sepsis receive evidence-based care that may save lives. Thank you.